And I'm just quite fascinated in this. Let's start with the kind of moment where host Julie Etchingham asked, and I'm paraphrasing, but if a loved one, if somebody you knew, one of your family members or whatever, was in a huge long waiting list and needed treatment more urgently, would you pay for private healthcare to get them seen? To which Rishi Sunak said yes, and Keir Starmer said no. Andy, what did you think of those answers?
Well, I've got a huge amount of time for Wes Streeting. I think on the NHS, he is by quite some distance the most thoughtful politician in the UK. I think he may be the only thoughtful politician in the UK when it comes to the future of the NHS, to be honest with you. So I've got really high hopes for what will happen to NHS England, and less high hopes for how much it will knock on to NHS Scotland, but high hopes for what will happen to NHS England under Wes Streeting. But I found Starmer's answer just so lazy, to be honest. And just so stereotypical of, that I better give this answer so that it looks like I'm supportive, and unquestioningly supportive of the NHS. We have a problem in this country in the way that we talk about the NHS, because we start from the premise that it's actually a good service, and it isn't. It's not. We put in roughly the same amount of money as the average OECD country into the NHS, not more, but not less. And our service is demonstrably worse. We have significantly fewer doctors, fewer beds, fewer scanners. Our survival rates from the 3 key killers are significantly poorer. And all our European neighbours, Scandinavia, France, Central, Western Europe, they all have mixed systems. All of them do. So there is effectively a form of social insurance system. It's not privatised. That's the other stupid attack, which obviously the SNP have been onto again last week, saying that Labour are going to privatise the NHS, which is just, again, just such lazy, patronising rubbish. All of these countries have mixed systems, and in all of these countries, this wouldn't even be a debate. That question wouldn't be asked last night, because you use the capacity that exists in all these Western European countries. And that's all that question really was about. The reason that we have this debate of, if you had the money, would you do it, is because we have a capacity problem, which is caused by the fact that we don't run the NHS well. We've got a system which no other country in the world would choose to use. So Starmer's answer to that, I understand why he's giving the answer, because it's the answer that Labour leaders are supposed to give to this question. But the right answer to that would be, do you know what? I'm disgusted that we even have to answer this question. The only reason we're answering this question is because the NHS doesn't work, and my Health Secretary, Wes Streeting, has a plan to fix it. Obviously, I would expect that anybody who is in need and can't get an operation on the NHS and has the financial means to do so, I would expect them to do that, and I would be no different. But I don't want to be in a situation where anybody has to do that. I want to be like other European countries where this is not an issue. And I also objected, as the husband of a doctor, I also objected to the sort of premise that he put forward last night, that because his wife works in the NHS, you somehow have to unquestioningly support it. I mean, that's the opposite of the truth. It's the people who are in the NHS, who are working in the NHS, who need to stand up and say, this is failing. It is failing our people, and we need to start again. And that is what we need to do. I'm still hopeful. I'm still hopeful about Wes Streeting. I'm still hopeful that Keir Starmer will do the right thing. But I'm just dispirited that we still live in a culture where he feels he needs to give that foolish answer to that question.
Well, firstly, I think that if Keir Starmer had given an answer that didn't start with either the word yes or the word no, he would have been accused of prevaricating and avoiding the question. So I don't think there was any alternative but a yes or no answer. Now, I think that while you can say, well, hypothetically, he's got lots of money, is he really going to, sacrifice a family member for political principle? That answer is because I think there's a sense of, that answer is for people who have a sense of fairness about essentially that with the NHS that we're kind of the idea that we should all be in it together. And they don't like the idea of basically that 2-tier service. And they don't like the idea of essentially people being able to buy it. So that answer was for the people like that woman, I think her name was Janet, who is sitting in the audience, and she doesn't have the option of being able to pay to skip the queue. And the vast majority of people in this country don't. Even because there's the difference between, if you have medical insurance, that's one thing. But paying actually privately for an actual surgery is a very different thing. Because that question is about actually buying the surgery, which would be having to pay tens of thousands of pounds in one lump sum in comparison to paying for insurance. And I think that's an answer for them. So I don't mind
But
that.
so
I think
why
that's
doesn't
authentic.
why doesn't he just say then, Janet, you know what, I would because I have the money, but what really drives me and what I want to fix is the fact that you can't because you don't.
Because I think that's an awful answer. I think that's
that was basically Sunak's answer, in effect.
Well, yeah, but that's because that feeds into exactly the kind of person that you think Sunak is. Because like Sunak's answer in the first question, which was about cost of living, he was like, "I'm really sorry for you that you've been having a hard time, and lots of families will know your experience." The unsaid thing was, "But not mine."
Yeah, okay. So I agree.
And
I don't disagree. But if you're a viewer, right? And it's been 6 months since you've been to the GP and you still haven't been to the orthopaedic surgeon at that point, and then you get referred, then you get put on your waiting list, and soon enough it's 2 to 3 years before you actually get that hip replaced. That means that you can't walk and you can't work and you can't do any of the things that you want to do in your life, and you've probably had 10 years taken off your life expectancy at that point. Do you really think that their answer to that question would be no? No way.
Well, I think the point is that the vast majority of people don't have that option, and I've got plenty of clients. I work in personal injury, and I've got lots of clients who are injured, either road traffic accident, whatever it is, and they're in exactly the same situation. And they don't have the ability to be able to access these things, and their surgeries are postponed and whatnot, and they're just not in that situation to be able to pay for it. So I don't mind that answer. And again, I think that I actually, on a kind of similar topic in relation to private provision, I would have liked Starmer to push back in relation to the VAT on schools answer that Sunak gave. Sunak gave the answer that basically, I don't think that hardworking people who care about, are invested in and are aspiration for their children should be penalised in relation to this, because that's what my parents did for me. I mean, it's insulting that the idea that the converse is true, which is that if you're not hardworking, then other people whose kids go to state school aren't hardworking and they don't care about their kids' futures and they're not aspirational. I would have really liked Starmer to push back on that, because that again, I think, is a dividing line between them, when a lot of this is the idea that they're just the same.
I agree with that. I thought the school's answer was poor, but it's a slightly different argument. I think the problem with the NHS answer, we can get onto the schools because I have views on that, but the problem with the NHS answer is an unthinking and unquestioning yes. Sorry, an unthinking and unquestioning no to that question. No, I wouldn't do it. All that does is perpetuate the problem that we have in this country, which is that we don't have a grown-up discussion about the NHS, and we refuse to accept the fact that in this country we are the outliers in having a health service run like this.
That was not, there was very little about that debate last night that gave the space to have a grown-up discussion about, frankly, any kind of policy. So while you might have a point about having that argument, that wasn't where we were going to have it.
Listen, this is fascinating, listening to this exchange, and you're both putting across very good points, but it's the party of Nye Bevan, right? And if he goes in and says, I would pay it myself because I've got the money, Andy, crying out loud. I mean, that's political suicide.
We wouldn't be talking about £2,000 tax if that's what his answer had been.
Doesn't he get honesty points though? Isn't that the thing here?
No. But what I'm going to say, and where I do agree with Andy, is you can answer the question, say, yes, I'd use the NHS, and this is what I'm going to do to improve it for people like you, Janet, and this is why we're going to try and improve matters. That's exactly why we need a Labour government. That's how you get into it, right? I don't think you can say, I'd pay for it myself in that respect, because it's a debate. It is that set piece event. There isn't room for the nuance and the context that you want to set out. So I see both of your arguments. I actually think I strengthen both your arguments, but I tend to side with Kat on the answer. I don't think there was anything else you could have said, in that respect.
You could. I mean, we shouldn't dwell, right? Because But anyway, it's a better debate than they had last night. But what you okay? So let me just road test something with you. What if he said, "Do you know what? I honestly don't know what I would do because I'm not in the situation. I never have been. I don't know what I would do. I don't know what I would do if I was sitting there desperately needing something to be able to go about my life. And if I had the money to do it, I don't know what I would do. But what I'm going to focus on is to fix X, Y, and Z." Surely you could have said that at least.
Well, that's a variation on what I'm saying, right? But my point is, you've got to give the guys a bit of credit here. Both of them, they're asked a question and they've got to come up with an answer. We've spent the last 10 minutes discussing this issue about what you should and shouldn't have said. I mean, what would we have said in that situation? It's pretty tough,
And this was our seventh take.
It's pretty tough. You just got to remember that. I'm
fair play.
In the moment, I'm just not sure there's any other answer.
I get it, and I know how hard this issue is, especially for Labour. I do get that, and I'm not, I'm offering the contrary view. I'm not dismissing what Kat's saying because I do get, it's a difficult issue. I just think if you look at public expenditure in this country, the two things which are holding this country back for decades to come are expenditure on health and expenditure on welfare. Those are the two things this country needs to somehow fix in order to actually move on, or the economy simply can't function, the country can't function. And to just continue with this myth that we have this great health service that we have to protect is just an embarrassment, to be honest.
Yeah. But Andy, you're not getting that in 45 seconds, are you? That's right.
I just did it in about 32.
No, you spent the last bloody 10 minutes. Right, okay.
Thank you so much for watching. Press subscribe and you'll get all the best videos offering insight on Scottish politics delivered straight to your feed. Press subscribe and stick around. And if you'd like to hear our conversations in full, open up your podcast app and search for Holyrood Sources.